Many African countries face health dilemmas as economic condition worsens. Africa faces infectious diseases like HIV/AIDS, malaria, measles, pneumonia, tuberculosis, and dehydrating diarrhea. There are several international aid groups, non-governmental organizations, governments, and nonprofit that are improving healthcare conditions in Africa while improving public awareness. However, there are still obstacles to providing healthcare. Only 28% of patients receive medicines they need due to much of population living in remote communities that are only accessible by lane, sand, or dirt paths. As a result, health workers cannot easily reach the vast population living in remote locations. The most effective solution is Riders for Health, an international nonprofit organization that provides motorcycle maintenance training to African health workers.
A key principle of Riders for Health is vehicle maintenance. Riders requires all enlisted health workers to perform daily pre-ride inspections of their bikes in order to prevent breakdowns and future damages. In addition, Riders trained technicians perform monthly maintenance on all bikes and replace parts that pose the highest risk of failure. This interaction between health workers and technicians allows for periodic reminders on riding instruction and vehicle maintenance practices. Through the Riders for Health program, the useful life of a motorcycle can be extended from roughly 20,000 kilometers to 80,000 kilometers. Another major priority of Riders for Health is promoting human capital development within its countries of operation. Riders accomplishes this through having locally managed programs so that the technical and administrative skills their managers develop are retained. By building local talent, Riders for Health becomes more than an outsider organization and invests its time and energy to empower locals.
Riders for Health manages an efficient parts ordering system. By keeping accurate maintenance records, Riders for Health can schedule the ordering of parts with precision. This keeps parts arriving on time and limits the amount of cost and waste associated with operations. Since Riders for Health has lower overhead due to their efficiency, more money is donated towards actual operations than administration fees. This ultimately means that money is better spent with Riders for Health than a majority of other NGOs.
Riders for Health has the potential to benefit many other countries. Remote areas of other developing countries can be reached with life-saving vaccines and healthcare. Also, with programs being run by locals, it will allow for human capital growth through the training of medical staff and technicians. These programs have the potential to improve healthcare systems and lower transportation costs in multiple countries. We are asking you to join the fight today. If you donate to Riders for Health, your money will be spent the way it's supposed to and will make genuine impacts on the lives of rural people throughout sub-Saharan Africa. We can save lives one rider at a time. Join the crusade today by visiting riders.org.